So my name's Emma and I'm ST7 in paediatrics, currently working at Northwick Park Hospital. And the topic for today's session is going to be on getting involved in service development work. So what I hope to do today and to cover today is to help you to know where to look to get involved in service development work, and be aware of some of the key considerations to think about when you're picking a project and deciding what to get involved with, and have some idea of how to approach a service development project. And I'm going to go through an example of a project I worked on transition most recently, with lots of kind of key pointers, tips, things to do, things not to do, things that I learned along that journey. And most importantly, because this is going to be a fairly brief session, for you to know where to go to learn more. And this session will link to some of the progress outcomes on leadership and team working, but also on quality improvement as well. So there's not too many of us in the room. So what would be lovely is it would be great to hear from the people in the room who you are and what kind of stage you're at in your training, and if there's anything that you want to get out of the session, if you could either unmute yourself or give a little tap in the chat bar, and I can hopefully try and address those things as well. So if anyone's brave and wants to either unmute or write in the chat bar who you are, what sort of stage of training, and anything specific I can help you with today on the theme of service development. I'll give you a couple of minutes to do that and see if I can get my slides up. So thanks very much to Becky for letting us know who you are. So Becky and ST8 in general peds, and a bit of a refresher on how to make service development effective and useful. So hopefully we'll be able to do that with some examples from the transition work that I did. And for those of you arriving, I'm just asking if those joining can just let us know what sort of stage of training you are, and if there's anything specific you want to get out of the session. Okay, so thank you for your... Oh, hi, Janky.
Sorry, just going to move on to type. My name is Janky. I'm probably one of the more junior people here. I'm an ST2, and there wasn't anything in particular that I wanted to get from today's session, just a general overview of how you guys are making all the changes that people seem to be making, and kind of get a head start, I suppose.
Lovely, yeah, so perfect. So this is what I hope to do today. So whilst we've got a range of different people here at various different stages in the training, I hope that there'll be something that everyone can kind of take away from this. And I can see, yeah, I can see lots of things in the chat bar that I'm hoping that I'm going to cover today. Some of the challenges, how to get work done within short rotations, how to kind of venture out of the clinical side of medicine to think more about service improvement work, and how to overcome barriers and resistance from a team. Lovely. So thanks to everyone who's kind of participated and let me know who you are. Feel free to interrupt at any point during the session, either by unmuting yourself, or I'll keep an eye on the chat bar as well. If there's any questions, queries, comments, and I hope that we'll have a brief little bit of time at the end, maybe, if there's any sort of specific projects that people are working on and that they're having challenges with, that we can maybe discuss as a group as well. So it's really hard to think about this kind of work, I think, when you're at the start of your paediatric career, because you've got so many things to learn. You've got your exams to do, you've got your portfolio, not to mention a really punishing rota. but there's lots and lots of things that you can do. And one of the things that I found during my training is when I started to get more involved in improvement work and in service improvement work, I started to enjoy work a lot more, because most of the time you can feel a little bit like you're firefighting. And like you're seeing the same problems over and over again, and seeing the same problems over and over again has really been a sort of a strong motivator in terms of getting involved in service development and improvement work. So I'm sure these examples that I'm going to run through with you are really familiar. So common problems that we've all experienced, things like, why are we still working with on a paper system where we spend half our lives trying to find the notes? Why is handover so long, so ineffective? Why do the same themes keep coming up? Why is that young person spending 23 hours in A&E waiting for a CAMS assessment? And why do I see all these healthy babies that keep coming to the emergency department in the middle of the night with these stressed out parents, when this is not the right place to necessarily to help them? So it's out of these frustrations that everyone will experience throughout their career, that you might find find a hook or a way in, something that you want to improve from those frustrations. But as well as thinking about the frustrations, I hope that many of you during your career will find also inspiration. So you might hear about a really amazing project at a conference or a study day that actually you think could work really well within your organisation, and that might be the way in. So I don't know how many of you were at the School of Paediatrics conference, but Akudo from North Mid has done such an amazing job of developing a parent education programme, and that's really inspired me with some work that I hope to do in the future. You might meet someone who really inspires you. So I'm thinking about one of the wonderful nurses who won Nurse of the Year this year at Royal London Hospital, who set up Your Stance, where she saw the problem of young people frequently attending as a result of knife crime, and sought to address that within the community by teaching young people basic first aid skills. You might find inspiration in the form of a hospital that has a particularly good service. As you rotate round, taking those ideas from one place to another can be another way that you find a really great idea for doing something well, that can be the inspiration behind your improvement work. Or you might have a really supportive and encouraging supervisor who gets you involved in something that they're working on. So an example of this for me was in a recent role, my supervisor got me involved in putting together a business case for a redesign of the emergency department. So using some of the skills that I'd learned over my time there, thinking about how the department works, what are the common conditions, using data that we already had that was quite accessible, to think about what does a floor plan need to look like? What space do we need in paediatrics? What do we need to ask for? How much is this going to cost? So that's another way I was able to sort of get involved in this kind of work. So inspiration and frustration are kind of two ways, two sides of a coin really, to think about getting involved in improvement and development work. But thinking about which project to choose or which thing to get involved with, what you think will be most useful to you and most useful to the service, can be sometimes a little bit tricky. So there's some key factors that you need to consider when choosing a project, or when saying yes to a project that's perhaps been suggested to you. So the first thing is thinking about motivation. So there will be lots of people who want to get you involved in projects, but actually it's not necessarily something that you're particularly passionate about. It doesn't really strike a chord with you. And although you know, we're supposed to have time within our days and our job plans, etc., to do this kind of work, if you're not, the reality is that you're probably going to at least spend some time outside of work thinking about these things. So if you're not motivated in the first instance to work on something like this, then you're going to find yourself with some started perhaps projects that you say yes to start and don't finish. The next thing to think about is time. So I think it was George popped up in the chat bar that he found it difficult. One of the things he wanted to think about was, how do you get involved in QI when you're having 6 or 12 monthly rotations? And this is a challenge when we're continually rotating around to different places. Absolutely, it's a challenge. So it's thinking about what's the size and scale of the project that you're getting involved with. Not fully finishing a project is okay if you've planned for sustainability within that project, and we'll talk a little bit about that when I run through the transition work that I worked on. But yes, your project needs to be to time, be feasible. You need to be able to get it to a point where it can be nicely handed on to the next person, or where you've achieved at least something worthwhile along the steps to making your improvements. The next thing to think about is power. If you're trying to address a problem and you've got limited time, potentially limited resource, you need to think about whether the solutions to the problem are within your sphere of influence, within your sphere of control. And how motivated are the rest of the team to address this problem? Because if this is a problem that's not within your team's sphere of influence, and you can't get people in your team kind of motivated to kind of come along with you, then it's going to be tricky. And we'll talk a little bit about how you overcome barriers and resistance from a team when trying to introduce new ideas as we move through in the example. And then finally, thinking about the impact that a service improvement project might have. So that's really key. You want to have a project that's going to have a lasting impact, and not be something that that is only sustained while you're in post. And building and thinking about what the impact is and the impact for patients is key, but also thinking about sustainability again. We can keep bringing that up. That's going to be the next step. So I would say, and I'm aware that I've got some quite senior trainees within this group, but for those of you who are sort of starting out in your careers, one of the strongest recommendations that I would make to you is to get good QI skills, as I think this is the first step. Even if you're not even if the project itself doesn't necessarily follow the quality improvement methodology of the model for improvement, and the tools that you will obtain from a QI skills course, such as the School of Paediatrics Change One Thing course, around how to explore a problem in a structured way, will be absolutely invaluable to you in any kind of project that you're going to be working on and involved with. So I think that doing this course was a real turning point for me in terms of getting involved in this kind of work. It's available, it's online, the faculty are really inspiring, they will really help you to maximise the impact of any project you do. So I would absolutely recommend that course, and I'll also towards the end point you in the direction of a couple of other resources that you can use tools from the world of QI that might help you with thinking about a service development project. Okay, so that first section was hopefully helps you to think about how to pick the right project and how to kind of get started. Does anyone have any questions or queries, anything you wanted to think about from or reflect upon from that first section about picking a project, or anyone got any sort of questions they wanted to ask about that before we move on to the next section? Yeah, so that's a really great point from Edward. So quite a few hospitals do have QI teams that can help you, and I think it's a really good point that actually when you're thinking about this kind of work, there's lots of people that could potentially help and support you, and it doesn't have to just be within the medical team. So an example of this is I'm currently working on asthma in my hospital in North West London, and we have support from the transformation team. So I'm working with a manager from the transformation team who is looking at our asthma pathways and we're working on this together. And the benefits of this are that we've got the perspective of someone outside of the kind of clinical sphere. You can ask those questions that sometimes we forget to ask, like, why are we writing things down in 3 or 4 different places? We can be quite accepting when we work in a system of the things that just don't make sense, and so having that challenge from outside can be really, really valuable. Fab. They can also help you with things that can be a little bit tricky, like who to talk to in IT to get things changed within your kind of clinical systems that would make things easier and help you address a change objective. So definitely recommend thinking about looking outside the clinical team and thinking about if you've got a QI team, a transformation team that might be able to help. Fantastic. So this next bit would work a lot better if it was quite interactive. So I'm going to talk to you a little bit about a task that I was asked to do in a recent job. So my task was to develop a trust policy for transition. So transition so the process of transition is thinking about how we help young people with chronic illness move from a child-centred to an adult-centred service, bearing in mind the huge differences between what those services are like and how they're expected to interact with them, but also thinking about the wider needs of that young person with a long-term condition or chronic illness. How do we help them to increase their control over managing their condition, and how do we address their biopsychosocial and developmental needs as they change throughout adolescence? So I had to write a trust policy for transition at a large teaching hospital. Transitions typically are done quite badly. It's something that's been written about a lot. There's nice guidelines on it, but it's very rare to find a hospital that actually kind of fulfills their kind of responsibilities within the guideline. So I've got to write a policy that affects children's services, adult services, that affects young people, that affects their parents, that affects nurse specialists, that impacts on primary care. Where should I start? Any ideas? If you were asked to do this, what sort of things might you think about doing? Yeah, so thank you very much, Edward. So looking at other policies at other hospitals, yeah, that's a really good starting point. Any other suggestions? Great. What's the current process? What staff and resources currently given for this? Yeah, really good point. Fab. Meet with stakeholders. Excellent. And what would be the ideal? What is currently being done? Great. Check current guidelines. Fab. So the situation and ask service users. Yeah, really good point. So I'm going to be covering these points, but it's really good to know that a lot of you are kind of on board with some good ideas of where to start with this. So the situation and the trust that I was working at was that some specialities had policies for their like disease specific sort of disease specific policies. Some of them had some kind of transition clinics that worked quite well. Some had nothing at all. And obviously that we're dealing with in a large teaching hospital, you're going to have young people with conditions ranging from diabetes to inflammatory bowel disease to kind of surgical specialties, surgical problems, all sorts of different kinds of conditions. Allergy was one, and some services were more developed than others. So this kind of brings me on to a point about how do policies improve services? So the situation with transition, and this is sort of quite widely reflected when people have researched this, is often you've got pockets of really good practice within an organisation, but that it's rare that spreads kind of organically to other areas. So what the task was in terms of the transition policy was to have a policy at trust level so that you could get buy-in from across the trust, from children's services and adult services, and also and really sort of set that strategic direction, and really make all services accountable for following those things in transition, which we know make a difference for patients. So that's why we needed a trust policy, and this some really interesting research on thinking about a concept called developmentally appropriate care, which is related to transition. So thinking about how we provide care that meets the developmental needs of young people as they move through adolescence, and really there needs to be, for this to be effective, we need to think about this at organisational level and have that as a strategic kind of direction. So that's why we needed a policy, and we needed a policy that applied to children's services and adult services. So with transition, it's really important that we just don't keep all the transition for ourselves in paediatrics, but actually it's a joint responsibility between children's services and adult services. And we needed it to apply to the whole trust. So I was quite daunted by this task, because I thought, well, I've never sort of transitioned a patient, like I've never really been involved in the process of transition, because I'm a paediatric trainee and we move every 6 months, and so I haven't really been involved with long-term care. And so for me, that was a task that was quite daunting, and one of the things that I learned along the way, which I think is really relevant to all kinds of service development work, is that you don't have to be an expert in a particular area to be able to do something like this. And you can learn these things along the way, and you can use expertise that you may not necessarily think that you have, but and transferable skills that you've developed in your clinical practice, to really kind of become an expert in your area. So during this process, I would say I became a bit of an expert in transition, and we'll talk about how I kind of approached it, how I learned along the way, but also I was so very much kind of trying to focus on what I could bring, which was with my interest in young people's health, kind of what's the young person's perspective, what are the wider issues affecting young people, and I think this was something that was quite valuable to the subspecialty teams, because they were very much focused on their kind of disease specific areas, but what are the wider needs of young people was something that I was able to bring. So with any project you're working on, I think a key message would be not to underestimate your expertise, but also not to feel that you need to be an expert or you need to be ST6 or ST7 to be able to do something, to be able to make a change, really to just have an open mind and learn along the way, and really be a force for action. So there's been lots of really great suggestions in the chat bar in terms of how you might address this task that I've been faced with. And so I've kind of divided them up into read, analyse, observe and listen, with listen being a really, really key one. And I'm so glad that I could see answers around asking service users and ask parents and thinking about stakeholders, but also one of the key stakeholders being young people and their families, because that's really key. So my first sort of starting point was reading a lot about transition, and I was very lucky as to the timing of my my work on the policy, because a really, really helpful piece of research that was very applicable to the problem had been published by the Transition Research Programme. So as one element of this work, they looked at all the proposed beneficial features of transitional care, so all the things that the NICE guideline tells you to do, but then they looked at whether they actually had an impact for young people in terms of both their health outcomes, but also their social participation after transition. And so this was really helpful because it was new. It was something that not necessarily everyone within the team had heard about, and it really helped to prioritise what was needed in the policy. Because what I needed to do was to come up with a policy that actually addressed that would work and would be realistic for young people who are seen very regularly in clinics, something like diabetes, through to conditions like allergy, where they're not actually seen that often, and the kind of relationship's not as kind of intense. And so, what are the things that cross the boundaries? What is relevant to everyone? And then and what would be a good kind of strategic direction for the policy, which could be applicable no matter what the condition. And so this piece of research looked at young people with a range of different conditions, so it was really, really helpful. So in addition to this really useful piece of research, I was also able to looked at other guidelines in other trusts and thought about, well, what's the difference between that trust and this trust? So thinking about sort of the children's hospitals, they have a particular way of they have sort of particular way of structuring their transition processes, for example, which wouldn't necessarily work in the non-children's hospital that I was working in. And specific kind of transition policies within specific subspecialties is also helpful.
2 rooms. No.
And the next thing I did was I spent lots of time observing. So if you think about a young person with a long-term condition, so if we go with inflammatory bowel disease, where should I go to observe care and see how care's done? Has anyone got any suggestions for where should I go to find out how care is currently being delivered for young people across transition? Any suggestions?
Okay, I'm going to think about it, and I'm going to I'll reply to your email, okay, with a code. I didn't realise, I did not realise I would get to choose my own code. That's exciting.
So so I went to the IBD clinic and any transition clinics.
Thank you, Layla.
Where else in
How
the
are you?
hospital
Are
might I
you
go
okay?
to find where else should I look sort of specifically in
Oh,
clinic?
good old Matt. Yeah, he's a good guy. How are you? Are you okay? Good, good. Yeah, we're surviving. Yeah, we're coping.
So
Thanks for your help, Layla. I'll
where I
went.
went to observe kind of care for IBD, for example, was I went along to the
Yeah,
clinics.
that's right. Yeah, perfect.
So
Thank you very much.
with IBD, this was a fairly well developed service, so I went along to joint clinics with the adult team, but also went to see patients when they were on the ward, and went to see patients when they were having infusions, both on the adult side and the paediatric side, and used this observation of both of clinicians and of clinical practice, but also used this opportunity to chat to service users, so the young people and their parents. So this, so when you're thinking about observing kind of the putting together a policy, it's important, or putting together an improvement program, it's important to observe the patient journey, but this can also provide you with an opportunity to start having sort of just informal conversations about with young people, which it's really valid. So we can do patient surveys, but often the best information, the most helpful information you can get is through having conversations with young people informally and their parents. So whenever you're working on service improvement work, I would really encourage you to have lots of informal conversations. Think about what you can get for a think about what you can get from a survey, how useful it's going to be for you. But yeah, conversations are really, really valuable. And in observing sort of practice across the trust, I was also able to kind of help out with things and to kind of start to build relationships, and that would really help. That really sort of helped me to start to get buy-in for the work. And because for some of the specialities, particularly where they were more developed, they were a little bit like, oh, well, there's this new, you're developing a new policy, but we already have one. And so kind of really making it clear that the aim was not to dictate to the services what exactly they would need to do, but really to provide overarching principles and support at organisation level was key. Fab. And then the next step was analyse. So I sort of gathered together previous work that people had done on transition across the different specialities, looked at how many young people it would affect, looked at how many staff it would affect. And a key tip here is to find, so a lot more systems are now electronic, thank goodness, and we don't have to traipse through notes so much. But if you can find a good person in your IT team to extract data for you, then you can really quickly analyse. That can save you an awful lot of time. Fab. And then the next step was to listen. So in transition, we need to think about the views of stakeholders. And there's quite a lot of stakeholders. Can anyone give me some examples in the chat bar of key stakeholders that I might need to gain the views of? So who might be important? Who would be involved potentially in delivering transition? Who is affected by transition? Is there anyone outside the hospital I should consult? Who do I need to get involved or to listen to? Yeah, so absolutely. So primary care was really key. So for some young people, they'll transition back to primary care. So getting the views about what works and what doesn't work from GPs, absolutely key. Had to engage a whole load of safeguards and the team running the clinics fab. So it needed to think about a whole range of practitioners from children's services and adult services, and especially like the key part of the puzzle, I think, was the specialist nurses, because they really have a big role in transition, and we've already talked about the importance of engaging young people. So there's lots of research already on young people's views on transition. So looking at that, so I'm very much looking at that kind of wider picture, what's already been done. So RCPCH and us was really helpful for this. But then but then having these informal conversations with young people. But a key point in the policy was building in ongoing opportunities for young people's voices to be heard sort of throughout transition. So if we think about the kind of the policy itself, in terms of measurement and measurement success, so one of the key things that was within the policy was to consult young people in any changes that are made to the service, and to set about mechanisms for doing that. We talked about looking at other hospitals' policies, which was really useful, but also reaching out to people and having conversations. So some of the most useful things that I did as part of developing this policy was just ringing and dropping an email to several of the of adolescent sort of nurse specialists, transition nurse specialists across London, who were perfectly happy to chat to me on the phone about what their about how they had implemented their transition policy at their hospitals, and that really was invaluable. And no one was kind of no one was sort of annoyed that I'd got in contact with them. People were really happy to share their work, really happy to share their time. So one top tip is just to not be afraid to reach out to people. If they don't respond to you, that's absolutely fine. But you'll be surprised by how many people you find along the way who are happy to help and support you with this kind of work. Fab. Cool. And so one of the key things I think for people that's come up quite frequently is how do we build sustainability into our work? So within the transition policy, and within sort of developing this work and engaging the different stakeholders, one of the most effective things I think I did during this time was to bring together a group of nurse specialists from different specialities to really really kind of connect with each other and learn from each other. So one example was when the diabetes nurse specialists, through one of the forums that I ran, was able to connect with one of the allergy nurse specialists, and who was in the process of setting up transition within that speciality, and arranged to kind of to share ideas, to meet, to observe each other's practice, and to provide kind of tips, tricks, advice, and so forging those connections was really key. And nurse specialists are great because, unlike us, they actually stick around. So thinking about who can you bring together that's going to be around in your work. And I think it's through sort of this kind of collaborative approach that I was really able to bring people along with me, and even where potentially there was sort of resistance at first, feeling like this is not something that was potentially necessary or applicable to people. So I think spending your time listening, forging connections, etc., is one of the most useful things to do in this situation. And then finally, in terms of kind of measuring success of your project, so with this one, it was a little bit frustrating, as we were hoping to get this policy approved at board level. After I'd written it, done all the kind of the hard work of getting and gathering the views, drafting, redrafting, getting all the stakeholders happy with the document. But unfortunately, COVID happened, and so I wasn't able to, during my time in that role, actually get it approved at a trust level. But it was complete. The hard work had been done, and I left it in the capable hands of my supervisor, who will be within a sponsor on the trust board to be able to bring this forward when time was available. But I think in terms of the sort of achievement of the project, it is really kind of bringing people together, sharing best practice, and within the policy, building in kind of continual improvement within that through clear clear opportunities to measure success, and opportunities for young people to share their views was absolutely essential. So my kind of take-home message from this work and from this session for you are, at whatever stage you're at in your training, you have knowledge and skills that can really contribute to service development, no matter what level, what stage of training you're at. QI skills are really important, and getting training in this area to really understand the methodology and get some of the tools that you can use to explore problems in front of you is a great place to start. Read, analyse, observe and listen is key to bringing people along with you and to really producing a piece of work that's going to be sustainable. And forming connections and bringing people together and bringing people along with you is the most vital step for sustainability. So I've got a couple of there's a couple of sort of resources that I can pop in the chat bar. So the QIC Learn course, if you've not heard of that, the Institute for Health Improvement's got loads of really useful problem solving and problem exploring tools, and I'd recommend you have a look at. And then if you're looking for more in terms of thinking about, for example, difficulties between primary care, secondary care, tertiary care, and looking at the bigger picture of child health, and the Programme for Integrated Child Health also taught me a lot about how to get started with these things, and so I'd recommend all of those resources to you. Does anyone have any questions or anything they wanted to ask, or any reflections at all?
I just wanted to say it was really brilliant. Thank you so much, Emma.
No,
it's been really great.
I've
learned loads. And also, can everyone please give Emma some feedback? She's taken a lot of time out to do this, so thank you.
You're very welcome. If there's no questions, I'm going to dip off because I'm on call for child protection and I really need to to make a phone call. But yeah, you can also feel free to email me if you want to ask more. I'll just put my email in the chat box. There we go.
You're amazing. Thank you.
No worries. Thanks, Selena. Bye. Bye, everyone.